This is GB News on TV, online and on digital radio. I'm Nana Akwe. Now, new government plans could see a crackdown on who could administer certain beauty treatments to protect patients from damaging injections. Figures from April last year suggested around about 6 million people in the UK are considering cosmetic treatments, but beauty practitioners offering Botox-style injections or dermal fillers don't need a licence, and there's currently very few restrictions. But an amendment to the Health and Care Bill due to be tabled on Tuesday would see the government have the power to introduce a licensing regime to anyone offering treatments. So I'm joined in the studio now by Dr. Shirin Lakhani, who owns Elite Aesthetics. Shirin, thank you very much for joining me. Now, how necessary is this particular legislation?
Well, Nana, the situation in the UK currently has been likened to the Wild West. There are no regulations in place determining who can deliver cosmetic injections, and there are no laws to govern it. So this is well overdue at the moment to try and bring some safety to patients.
Do you think it might give people a false sense of security, though? You might think, oh, it's all right, that person's got a licence, I'll go to them, then they'll Botox botch your face.
Absolutely. I think that there needs to be a lot more clarification on what this licence is going to involve. And certainly when I heard the news, I had mixed feelings about it, because I feel that while regulation is long overdue, this seems to be a soft-touch approach. I think there needs to be more laws on who can provide the treatments. I really do think the government need to stipulate that it should be medical personnel only. But they don't seem to have the appetite to do that.
So what's your background then? Because are you an ex-doctor, or are you a practitioner specifically in Botox? Or
so I started life in the NHS as a doctor. I graduated in '99 and worked in the NHS for around 20 years. Alongside that, I trained in injectable treatments, and the training never stops. It's a medical treatment, and I think at the moment we're the only country in the world where this situation exists, that non-medics can literally pick up a needle and inject someone's face without any qualifications, without any insurance, and without any recrimination.
My God, if anyone tried to do that to me, heaven help them. Have you ever had any Botox done yourself?
Yes.
Really? Never?
Yes.
Where?
Well, I have had treatments. I'm in my late 40s.
On your own?
I've got very good colleagues that I work with that I trust with my face. And all the people who do injectables in my clinic are all doctors.
Yeah.
And that's the way it should go. I mean, we've all seen the horror stories with the complications that can happen. These aren't like having your nails done or having your hair done. There are serious consequences that can occur.
Like what?
Like in extreme cases, you can cause blindness with dermal fillers.
Really?
Yes. So
how would that occur? You're not doing someone's eyes, you're doing around.
No, so it can occur from any injection in the face. People tend to worry about the ones that are around the eyes, but actually injecting someone's lips, which is such a common treatment now, undertaken by young girls, could actually lead to permanent blindness.
Really? What is it, the Botox going into the...
Well, it's dermal fillers that cause blindness rather than Botox, but it's injecting into...
the stuff that's going in.
So the filler gets injected into an artery and basically blocks off that artery, so it starves the tissue supplied by that artery of oxygen and causes death of that tissue.
Oh, wow. So if you get an artery that's going to your eyes, you could cause blindness. And is it reversible at all?
Generally, with blindness, it's not reversible. I mean, there are other areas where you get death of the tissue, which, if caught early enough, and that's the key, could be reversible.
So what are the biggest injuries that you see with the Botox treatment? Because I presume some people must come to you to sort of correct something that's gone wrong. Yeah,
so, I mean, most of it is to do with dermal fillers.
Around the mouth? Or
it could be around the mouth, around the eyes. The number of people coming through the doors now for correctional work is rising exponentially, and that's to do with the huge growth in the sector of non-qualified practitioners undertaking treatments. Now, don't get me wrong, complications can happen with everyone. Even in the most experienced hands, there is a risk of a complication. But the difference is, as doctors, we're trained to deal with them. We have access to the drugs that we need to dissolve fillers. And your general lay public member who's just decided to do a YouTube course or whatever and picked up a needle doesn't have access to that. A lot of the time they're incapable of recognising the complication itself.
Right.
So people get told, oh, don't worry, it's just bruising, when it's actually early tissue death.
Well, that sounds horrible, but the law should be a good thing, right? Ultimately, it's a good thing.
Ultimately, any regulation in this industry is well overdue, but the fear is that this isn't going to go far enough to protect the public.
Well, let's hope they police it properly as well, that you can't just grab a licence. Dr. Shirin Lakhani, thank you so much for joining me. Really good to talk to you. She's an aesthetic doctor.